When we're describing addiction, it's really important to take into consideration the terminology that we're using to talk about it. Why? Because the words that we use have different emotions and different feelings behind them. So if I say the words like addict, if I say junkie, if I say alcoholic, there's automatically a negative connotation or a negative image that comes to mind. But if I say somebody who struggles with a substance use disorder, or a person who struggles with an opioid use disorder, a person affected by addiction, what that actually does is separates the person from the disease. When we talk about addiction in terms of, we call somebody an addict or an alcoholic, we are essentially saying that the person is the disease, that all of the behaviors, all of the lack of choice, all of the using every single day is their fault. It's not a brain disease, it is their fault, they're making a willful decision. When we say that somebody who struggles with a substance use disorder though, then we're actually implying that they are affected by a disease that is out of their control. There was a study that was done where there was a group of patients being treated for substance use disorders, but they split the group into half. Half of them they referred to as substance abusers to the treating clinicians. The other half they referred to as people struggling with a substance use disorder. The group of people that were referred to as substance abusers were actually treated and prescribed a more punitive style of treatment, a more punishing treatment, as opposed to the people described as people who struggle with substance use disorders. They were treated in a more holistic, more caring way. They were not looked at as somebody who is the disease, they were looked at as somebody who has a disease. The phrase substance abuser actually implies that somebody is making a willful decision to pick up those drugs and alcohol every day. They're making the willful decision to hurt their family members, to hurt everybody they love, to lie, to steal, to manipulate, to do whatever they have to do to get those drugs. But everything that we know about addiction tells us that that's not the case. People don't want to do these things, but their brain chemistry is telling them they have to. The brain has adapted to having those substances in their system so much that they believe that they need those substances to survive. So calling somebody an addict, calling somebody an alcoholic, a substance abuser is heavily stigmatizing. It's wrong, it's ridiculous, and it can stop somebody from getting the help that they need.